This is Dr. Amy Ho, host of ACEP Nowcast. Before today's episode, we want to remind our listeners that registration for ACEP's 2026 Scientific Assembly is now open. Your specialty, your people, one place. Join us in Chicago this October and register now at acep.org/ACEP26 for free access to ACEP anytime.
Ryan Stanton here with ACEP Frontline, and today joined by Dr. Rob Anderson, and we're talking about the Emergency Physician Salary Survey, and this is actually something that ACEP has worked on now for a while, and it's kind of one of those things that's there, and many people there have gotten something in your email or communication about participating, and we wanted to kind of dive into what it means, why it happens, and why it's important. So first and foremost, Dr. Anderson, thank you for joining me on the podcast. Give everybody a little bit of background on yourself.
My name is Rob Anderson. I'm a practicing anesthesiologist, not an actual emergency medicine doctor, but an anesthesiologist who is the clinician co-founder of Marit Health. And Marit Health essentially started with my brother and I just talking about salary transparency and jobs. And the reason he's relevant is he was the chief of product at Glassdoor. And Glassdoor largely brought salary transparency to the tech world and the business world and left medicine untouched. And so over the past, 5 years, we've been talking about why it didn't really impact medicine. We need salary transparency more than ever as we've all been employed. And now, 80% of us are employed by large health systems or large groups. And so we need this more than ever, and we don't have it. And so we created Marit Health to really tackle this issue of salary transparency in medicine so we can be paid our worth. And that's really where the name comes from a little bit as well, is we want to be paid for our work and be paid fairly.
I think that's a big question. I think if docs grow up in an area, they kind of know what the environment's like. But if you come out of residency or you're in a situation where you're moving different states, different parts of the country, not knowing exactly what the market is for the work that we do. And we've seen stuff that have broken it down into regions of the country before. I live in Kentucky, which is Midwest, Southeast, depending on what benefits us the most at the moment. But the idea of saying, I live in this part of the country, this is what I can typically expect as an emergency physician, but driving down even further to say working in Lexington, Kentucky versus say in Louisville, Kentucky versus Northern Kentucky, Cincinnati region, drive down to say, what is the market driving for emergency physicians? So talk about when you started looking into the medicine, the physician space, and more specifically with emergency medicine.
Yeah. So really, we recognize that right now the content out there is just averages, right? And so MGMA is often cited as the gold standard. It has 200,000 or so data points, though from large employers, not necessarily private practice groups. To your point, they represent regions and averages. And so they don't allow you to dig into the actual real numbers. At Marit, we want to show the real numbers. And so we allow, once you contribute your anonymous salary, to dig into the data and unlock all the individual salary cards that we have. And so take myself, for example. I'm an anesthesiologist in Richmond, Virginia. We now have probably 25 data points in Richmond for anesthesiology through friends and all of that. Now, as we scale, we're going to get really, really good data into the metro level like you're talking about, which is really what changes the market. That's the market. The market isn't a region. It isn't a state. It is the individual city. It is the individual health systems and the individual jobs. And so that's what people need when they go to negotiate. So that's what we are trying to expose. Of course, we give you the averages. When you complete our onboarding flow, you get our data, but you also get MGMA data. So that is a value add that's probably worth $800. Many people have heard about MGMA data, but never seen it. And so we have licensed that data and give it away for free for verified clinicians. And we also have AMGA data. So we are really moving to be the gold standard salary transparency data set.
You actually answered one of my questions already, which was going to be the carrot for participation, which is the access to all of that data. It is kind of the thank you for being part of the information is you get access to the data afterwards. But why does you mentioned the 15 or so anesthesiologists in the Richmond area and starting to be able to build out that number to get an idea? Why does that participation matter? So when I get the email that says, Marit Health, here's your opportunity to participate. Great, you're going to get access to all this data once you're done. But why does it matter for you and for others that may be coming to your region with regard to participating and putting in the actual values of your work?
Yeah. So if you can get down to the metro level, not just if you're an employee and you are looking to negotiate, you want to know what those numbers are, right? And compensation in medicine is complicated. It changes depending on your employee, your hours, your call, how much you're working, how much PTO you're willing to take or not willing to take. It is complicated. And so when you can see those individual salary cards, you can actually see the story that explains the compensation. And that's the stuff that you can't get from averages. And so, yes, we have 15 to 25 anesthesiologist salaries in Richmond, Virginia. All of them are different, even though we're working for the same group, because the workload might be different. The call structure may be different. All of these things are factor into the whole story and the whole narrative. And so that's where it gets important to see the nuance of what's driving the individual salary. Now, that's for employed or practicing physicians. To your point, as you mentioned earlier, students, residents, fellows, they need this data more than anything because they haven't seen it before. They are learning the landscape. They need to know where they want to go practice, where they want to put down roots. They're entering cold without any relationships in the local community. So they need to come in with some sort of basis to negotiate their first job offer. And as you know, that first job offer gets carried from that point on. That's your starting point, right? If you negotiate low, you're going to stay low. Okay. If you negotiate high, that will get propagated into the future.
That's interesting because I wish I had this data back how many years ago? 18 years ago now when I finished residency. And of course, they hand me a contract and say you're getting paid at the top of the profession, and you should feel lucky to be able to get this as a fresh attending coming out and medical director for an emergency department, inner city emergency department. Come to find out, it was less than half of what was the private hospital-based rates that were going on. Not to mention some other shady business that was taking place. And when that contract transitioned to the university, about 8-10 years ago, all of a sudden the rates go up by $100 in order to make sure they recruit physicians. So, for me, not knowing the environment and potential employers coming in and making you feel great and that you're getting, that you're taking the king's ransom as you go, when in fact they're just giving you the scraps from the table. That's very important. And I think it's very important for our young physicians as they establish their career and establish their lives to be able to know that they're getting the true value of the commitment, work, and education that you've done. Now, as you mentioned, the complication, how complicated it is. I get it. I've done some of the surveys in the past. I'm paid pure RVU based on, it's not even RVU, it's on collections from my patients. There is profit sharing plans. There is benefits on top of that, depending on what you are. Are you 1099? Are you W-2? Or what is the kind of structure that you have? Break down how Marit does this structure to help potentially compare apples to apples, to where when I'm comparing myself to employed physicians at this one hospital versus 1099 contractors for another group across town versus my hospital where we're employees, but we are a pure reimbursement-based model.
Yeah, so a lot of these salary surveys are relatively generic. We were trying to, when we created ours, we were trying to balance, completeness with speed and efficiency, right? And so if you're too complete, people aren't going to get through the survey. If you're too simple, it's not going to really be actionable enough to move the needle on anything. And so we tried to strike that balance, and we created a survey that we applied across every specialty. And that's how we started. As we've started working with different professional associations, including ACEP, we are introducing a little bit more salary specific or specialty specific questions in there. And so to really reflect what emergency medicine is seeing and what moves the needle on contracts there. And so, yes, we have all of the average hours, we have shift schedules, we have compensation models. We also talk about benefits and time off and all of those things. And really, I just encourage everyone to go dig in. And it takes 2 to 3 minutes to actually complete a survey and go through onboarding. And then you can see the breadth of the data that we have at your disposal.
And the good news is that emergency medicine, along with family medicine, are the largest in terms of the current salaried surveys that are out there. Some are still in under 100, but emergency medicine, family medicine, over 1,400 individual salary surveys that are completed, and that is growing. And that is actually the goal of our discussion here today. Is you've gotten the email, you've gotten the communication, is going on there and filling it out to help fill out that data, build out that database so that we as emergency medicine, the American College of Emergency Physicians, that's actually in our name. We're about the emergency physicians and making sure that we're maximizing the opportunities for every emergency physician, is that data is out there and people know what's going on. So you don't pull a Ryan Stanton in 2008 and sign for much less than your value because they made you feel like that was all that you were worth at the moment. Because for most of us, you're worth much, much more. And we want to make sure that this is potentially driving the market. So let's actually roll into that. We talk about these surveys. We talk about the transparency. We want that transparency for our physicians to know what the environment looks like. How can this potentially drive these communities? You're in Richmond. As you grow out the anesthesiology data, how does this potentially drive the market with regard to that transparency and other physicians coming in knowing their value when they come into the Eastern Virginia market?
Yeah. For us in the anesthesia space, it's super dynamic right now. There are shortages across the board. There is a need for anesthesia services, and so the market is very dynamic, and we have seen compensation adjustments not quite every year, but every other year. And as you know, with MGMA data, it's relatively stale and old. It usually takes a year to actually get compiled. So when you see the data, it's a year and a half old. And that data is then used to drive future contract negotiations. Our data is live, it's fresh. You'll see things that have been posted 2 hours ago. And so you can go dig into this stuff. And really what we want people to do is just go look at the data. Instead of what used to happen is you'd have to almost go interview for a job to see what was actually being offered and gather the information. Now you can actually see self-reported data and go from there. And that's a good starting point. Certainly in a local community, relationships matter. Obviously building bridges between other providers and hopefully sharing, knowledge is also great, but you're never going to get the breadth of the data by just doing that.
And most employers, especially those that have a investor group or outside folks that are wanting some piece of the pie, they're not going to come in there offering you the max offer from the beginning. And understanding where your latitude is for negotiation and working with that group to make sure that you're getting your value out of it. It's as the rising tide lifts all ships. If I'm going somewhere that's saying, an emergency physician is worth $75-$80 an hour, come to find out they can't recruit anybody there, but that transparency is there because I can go to the next community and get that $225, $250, $275, whatever it is, which is a market value. That's huge. And I think that potential of raising that tide of helping facilities and groups understand that if you're paying subpar market value, then you're going to end up with difficulty recruiting and maintaining those physicians and allied health professionals. And I think this plays really well into the ACEP open book idea, where we're trying to increase that transparency with the groups, the contracting, due process, salaries, benefits, all of those different things. Let's actually dive into this from a little bit different angle. I'm a new physician out there. I'm a resident that's graduating the end of June, looking for gigs. Right now, over the next few months, is the prime time for signing contracts. And we got that 1099 number hanging out there, which looks great and it's wonderful. If you're good at managing your own money, you got the W-2 numbers and with benefits and things like that. What we found with a lot of the people we employ is that it is that bottom line number, and it's hard to calculate those benefits as in terms of a dollar value. Which honestly, this day and age, if you can find good, affordable health insurance, that's worth its weight in gold. Looking at some of the people who've looked at different jobs recently, from your standpoint with Marit Health, looking at those, weighing some of those differences, because I mentioned here in Lexington, I've got an academic setting. I have I actually don't have any more large group settings. I have an academic setting. I have a government setting. I have a large physician-based model. I have a small physician-based model. How do we look and compare those types of things and say making Richmond or Lexington an apples to apples comparisons of the jobs that are out there?
It is difficult. I mean, I think that new residents or residents that are coming out, they're oftentimes undereducated in terms of that. I mean, they're looking at that shiny number, right? That whether it be that 1099 or W-2, they don't understand all the nuance in terms of the benefits. We try to do our best to capture the benefits listed and the benefits received. But to your point, it's very hard to put a dollar figure on some of those benefits, whether it be healthcare or some of the PTO and all of that. What we really want to do is just expose it, and then you can do some kind of back channel, figuring out of what those numbers might be to get as close to apples. But it has to be exposed right out of the gate. And oftentimes this stuff is the stuff, the benefits package is the stuff that you won't see until you get to an offer stage. And so we want to show it up front and then allow you to kind of, negotiate with some knowledge and some leverage. Now we have seen people negotiate for higher pay, but the simplest thing to do is sometimes seeing that someone got $100,000 sign-on bonus or a $50,000 sign-on bonus, and say, hey, that just happened in Lexington. So let's try to get there. And maybe even just knowing what is possible allows someone to have the confidence to go and ask for a little bit more and push on that a little bit more.
It is about knowing, what's in that environment right there, because it can be very different. And I do want to take a moment to not only this survey in Marit Health, but, plug for Practice Essentials, because that is that program that is understanding some of those significant gaps that exist within resident education with regard to finances and employment and contracting and things like that. It's a great program that is a collaboration between IMRA and ACEP and part of the member benefit that you have there. So strongly encourage residents, students, if you have not checked out Practice Essentials, check that out. Now let's talk about this survey. I think some of us have gotten, or many people have gotten invitations, those types of things. How do people participate? Do I have to go find my email, or can I go visit the website and dive in?
The email is great if you still have it, and I think you can even go to the ACEP site as well to log in through that. If you don't have access to that, you can go to Marit Health. It's spelled MARIT health.com, and create a practitioner profile. Now we do a quick onboarding. It takes 2 to 3 minutes probably to fill out the entire thing. We capture it all. And we try to get deep, like I said, with the whole thing of balancing completeness with speed and efficiency. We don't want to take all your time, but we do want to get to a level that's actually actionable and usable for our whole community.
The relationship and collaboration with ACEP and Marit Health, the Emergency Medicine Compensation Survey is available on acep.org. Life as a Physician, the Career Center, and there's a space for the compensation survey. You can actually just go to Google as well, or the ACEP website. It's right there with the headline of only 1 in 4 EM job postings includes a salary, one of the lowest rates of any specialty. It's like anything else. The call for price, something's for sale and it's call for price. To me, that translates as it's too expensive. I think often with jobs, it's translates as you're not going to offer me as much as I would expect to have clicked on it anyway. But there is an opportunity there to get started, to get registered. It will be closing out. The survey deadline with this relationship is on September 4th of 2026. So if you're listening to this after that, sorry. But at the same time, checking out Marit Health, as mentioned, marithealth.com, MARIT health.com, and then the ACEP website with regard to the completing the survey. And as I mentioned, emergency medicine, even though there is still opportunities for increased transparency, it is one of the it has one of the higher number of surveys, and I'm hoping by the time this wraps up that we have hands down the most of all specialties put together with multiple thousand surveys out there to help guide you in your look for a job or understanding where you sit with regard to your job now, and opportunities for us to advocate for ourselves as emergency physicians. Talking with Dr. Rob Anderson, co-founder of Marit Health. Any closing thoughts from an anesthesiologist to the emergency physicians out there with regard to the salary survey and our opportunities to fight for ourselves?
Yeah, I mean, you were talking about salary transparency in the job openings and the job offers. We are now the largest job platform in medicine. We have all the jobs, and so with salaries on one tab and with jobs on another, we hope to move this whole medical environment to more transparency across the board. We deserve it. Obviously, we've trained long and hard, gone through the process. When you come out on the other side, you deserve to have salary transparency with your job. And so we want all practicing clinicians to contribute, but this is also going to help the students and residents to follow.
Dr. Rob Anderson with Marit Health, marithealth.com, also with the American College of Emergency Physicians Career Center. Check it out. You have through August and the initial beginning of September to get your survey in with this initial piece for our report. ACEP has done an annual report on salary, on emergency department surveys with regard to salary and the landscape that's out there. And appreciate the time, and thanks for the willingness to jump on and talk with us today.
Thank you. Pleasure to be here.
As for me, you can contact me, rstanton at acep.org, rstanton at acep.org. I encourage you to subscribe to the podcast on your favorite player. I also ask, please give us a 5-star review to help boost us up in the list so other people can get exposure to ACEP Frontline and the advocacy and work we're doing for emergency physicians and other physicians out there. And as for me, I'm Dr. Ryan Stanton, and this has been some ACEP Frontline.
If you're not on the front lines, you're on the sidelines.
Cue the music.
Bow, bow, bow.
There. Quiet place, all alone. Da, da, da.